Hi, everyone. We're here with my doctor, my surgeon, Dr. John Heffron. Hello, doctor. How are you, buddy?
Hello.
Good. All right. So, Doc, you're going to explain to me as we look at our x-rays what's going to go on here and what we're actually going to do in the surgery, please.
Yeah, so the bone is cut so that we have an alignment such that the center of the hip and the center of the knee are all in one line. So in your case, as you can see the shape of this bone, when I come up the tibia, you can see the angle here is not a right angle. So this will be cut so that this is a right angle with respect to the long axis of your tibia.
Right.
And that makes the ankle and the knee in the same alignment. And then on the femoral side, we cut off the ends of the femur here in this fashion, across here, and across here, and across here. And again, the angle that's selected makes these joints line up perfectly. So this may be beveled one way or another so that everything lines up. And that's the operation. And then the implants that will go into that space that we create are metal and plastic implants that are measured to fit exactly that space that we've made.
Right. So, Doc, you said to me that I come in on Friday morning and surgery starts early in the morning. How long is it to replace both knees?
About 3 or 4 hours.
Okay. And then you also said by the time I get out on Monday, I'm going to be able to bend my knees to what degree?
Hopefully you can bend to 90 degrees, but if you only get to 60, it's okay, because in the first week or so, you easily get 90 degrees of flexion. And then we hope that within the next 3-4 weeks, you'll get to 120 degrees of flexion.
Fantastic. And you're recommending that I'm going to be able to put weight on it, I'm going to function, I'm going to go through rehab, but I'm going to be able to get back to my life. What's my pain level when I get done with the operation?
Well, afterwards, you have some local anesthetic injected in there that lasts for a fair amount of time, and then it hurts. So the first night, it hurts a lot. And the first day after surgery is probably the worst day because it hurts and you're still recovering from anesthesia. We do get you up the first day and have you stand up and walk around a little bit. Sunday, which is 2 days after surgery, you start to feel better so that you're able to walk outside the room and get around a little bit more. By Monday, most people turn the corner, they feel much more comfortable. They're still on a lot of pain medicine, but they're not dopey from the pain medicine, and they feel like they can participate much better in therapy.
Well, I'm dopey anyway, so we don't want any more dopey, right? Now, doctor, I ran into other doctors that didn't want to do two at the same time. Why do you recommend it, and why do you think that's good for me?
Well, I think in your case, you're very physically fit. You're good at doing the therapy. So I think for your purposes, doing them both is very reasonable. Both your knees are equally bad, if you will. The downside of doing both knees is because you do have a higher incidence of complications. And the rehab is more difficult. So we're selective about who we do it in, and we want to make sure we have healthy people.
Right.
And people that are going to work hard in therapy.
Right. And I recommend that to anybody doing this. And the reason why we're filming this, Doc, is because, like me, so many baby boomers that I know and clients that we have are in a lot of pain. And you know me over 15 years now. You repaired my MCL on my left leg, and you know how much pain I've been in. But as far as the pain relief, I'm not going to have, as I stand here filming, I'm in a ton of pain. That's going to subside after a week or so. Are you correct? I'm going to have a different life, quality of life. Am I not?
Well, one thing that's nice about it is you have the surgical pain, which lasts for a while. But in a while being, 3, 4, 5 days up to a month, depending on the individual. But the nice thing about it is psychologically, the pain is different. So you feel like it's getting better. When you have a really arthritic joint, it's like every day it's the same deal, and your pain is the same or getting worse. Psychologically, when you start to notice that it's feeling better every day, it's a different kind of feeling. So it feels better, if you will.
Great. And I'll be able to get back to moderate weightlifting and strength training and range of motion and activities that I haven't done in years. Do you agree?
Yes, you should be able to do
Good.
that. Yeah.
Okay. Well, Dr. John Heffron, thank you so much. And we'll see you on Friday, February 26th, and we'll film again then. So thanks for your time. We'll see you then.
Very good.